blood. Blood is important for regulations of body pH, temperature, osmotic pressure, the circulation of nutrient and removal of waste, the distributions of hormone from endocrine glands and eliminations of excessive heat. It's also contain important content such as red blood cell, white blood cell, plasma which contain coagulation factor and serum, also platelet. The regulations of erythropoiesis consists of genetic factor, maturation factor, and factor necessary of hemoglobin production. In general factor, there are hypoxia, growth indicator, and vitamin. While in maturation factor, they are vitamin B12 and folic acid. Okay, anemia. Anemia is a decrease in number of red blood cells, which is lead to a decrease in hematocrit and hemoglobin content. Red blood cell mass represent the balance between production and destruction or loss of RBC cells. They are three basic mechanisms, which is blood loss, deficiency erythropoiesis, and excessive hemolysis, which is RBC destruction.
Etiology of anemia consists of blood loss, decreased erythropoiesis, increased hemolysis, chronic disease, nutritional deficiency, infections, and lastly, genetics. For the signs and symptoms, we can see dizziness and headache, fatigue, dyspnea, pale skin, cold hands and feet, and lastly, fast heartbeat.
There are three mechanisms of anemia. First, due to underproduction of RBC. Second, due to destruction of RBC, which we call hemolysis. And third, due to blood loss. So I will explain about the mechanism of anemia in details with diagram. So production of RBC starts in bone marrow, a spongy material at the center of bone. So it mainly contains hematopoietic stem cell, which will give rise to RBC, WBC, and also platelet. So kidney will instruct the bone marrow to produce RBC by releasing erythropoietin. This is a hormone which will stimulate erythropoiesis, a process of making RBC. So this is erythroblast, precursor cell of RBC, and this is erythrocyte, a major form of RBC, and it contains lots of hemoglobin to carry oxygen. The first mechanism for anemia is due to underproduction of RBC. This could be due to kidney failure, which will prevent the stimulation and release of erythropoietin and inhibits the erythropoiesis process. Second, due problems in bone marrow. This could be due to virus, tumor, or fibrosis, which will disrupt the process of production of RBC. Third is due to low production of precursor cell of RBC. Fourth, due to low hemoglobin, which is due to low iron in body, because iron is the main component of hemoglobin. Second mechanism of anemia is due to destruction, or we call hemolysis. So it can be due to autoimmune, where our own body system attack our own RBC, or maybe due to some pathogens, virus or bacteria, which they will invade the RBC and make it hemolyze. And the third mechanism is due to blood loss. This could be due to trauma or tear in your own blood vessel.
Explaining on the diagnosis for anemia today. Okay, the very first diagnosis for anemia will be the complete blood count, which is known as the CBC. This CBC is actually used to count the number of blood cells in the blood sample. Next diagnosis will be is to test and determine the size and shape of the RBC. This is actually done to check on the unusual shape and sizes of the RBC. The last diagnosis will be the physical examination, like for example, doctors asking you on your family history, any pain, and some sorts like that. Next, about the treatment. The very first treatment to treat this anemia will be, for example, if the anemia is due to iron deficiency, the patient will have to take iron supplements. If in case that the anemia is due to vitamin deficiency, this will make the patients to take vitamin supplements like vitamin C. Next, blood transfusion. The next treatment will be having injections of synthetic hormone. This synthetic hormone is to actually stimulate the RBC production and to ease fatigue. Next treatment for this anemia will be, if at all it is aplastic anemia, the one best treatment will be the bone marrow transplant. Next, if at all it's a hemolytic anemia, the best treatment is by treating the infections and taking drugs, to suppress the anemia. Next, the last type of anemia will be sickle cell anemia. If at all a patient is going through sickle cell anemia, the best treatment the patient can come up with will be pain relievers and oral intravenous fluid. This intravenous fluid is actually given to reduce the pain the pain in the patients. Okay.